Welcome to our video series, Conceptual Relationships of Words in the English Language. In this series, we present English vocabulary in a structured and hierarchical manner. Each video showcases a range of terms and their corresponding definitions, presented in an organized sequence from broader concepts to more specific details. The series is divided into playlists, videos, and sections, each delving into distinct aspects of the English language. To get the most out of these videos, here are some of the suggested uses. We will be using WordNet as our primary reference throughout the series. For detailed information about WordNet, please visit the official WordNet website. If you're new to our channel, we recommend starting with our introductory videos. They provide essential context for understanding our approach, purpose, and methodology. For simpler navigation, we presented an outline of the terms and relationships in one of these introductory videos. Remember to show your support by liking, commenting, sharing, and subscribing to our channel. In this episode, we will explore Disorder Part 2. This covers mental and nervous disorder. This video is part of the playlist Attribute State. Attribute State playlist is one of two playlists devoted to the conceptual domain attribute. Attributes are linguistic elements that serve as modifiers to provide descriptive information about another word. They convey qualities, characteristics, or properties associated with the entities they modify, enriching the meaning and context of the expression. Section 1. In this section, we will explore miscellaneous mental disorder.
Condition. Condition.
A state at a particular time.
The current status of the arms negotiations.
Physical condition. Physical condition.
The condition or state of the body or bodily functions.
Disorder. Disorder.
A physical condition in which there is a disturbance of normal functioning.
The doctor prescribed some medicine for the disorder.
Mental disorder. Mental disorder.
Psychiatry, a psychological disorder of thought or emotion, a more neutral term than mental illness.
Aberration. Aberration.
A disorder in one's mental state.
Asperger's syndrome. Asperger's syndrome.
A psychiatric disorder usually noted during early school years, characterized by impaired social relations and by repetitive patterns of behavior.
Conversion disorder. Conversion disorder.
A mental disorder characterized by the conversion of mental conflict into somatic forms, into paralysis or anesthesia having no apparent cause.
Glove anesthesia. Glove anesthesia.
A mental disorder involving loss of sensitivity in the hand and wrist.
Since no combination of nerves serve this area, a glove anesthesia is clearly psychogenic in origin.
Delirium. Delirium.
A usually brief state of excitement and mental confusion, often accompanied by hallucinations.
Delusional disorder. Delusional disorder.
Any mental disorder in which delusions play a significant role.
Dissociative disorder. Dissociative disorder.
Dissociation so severe that the usually integrated functions of consciousness and perception of self break down.
Depersonalization. Depersonalization.
Emotional dissociative disorder in which there is loss of contact with your own personal reality, accompanied by feelings of unreality and strangeness.
Fugue. Fugue.
Dissociative disorder in which a person forgets who they are and leaves home to create a new life during the fugue. There is no memory of the former life. After recovering, there is no memory for events during the dissociative state.
Split personality. Split personality.
A relatively rare dissociative disorder in which the usual integrity of the personality breaks down, and two or more independent personalities emerge.
Encapricis. Encapricis.
Involuntary defecation not attributable to physical defects or illness.
Folie à deux. Folie à deux.
The simultaneous occurrence of symptoms of a mental disorder as delusions in two persons who are closely related, as siblings or man and wife.
Neurosis. Neurosis.
A mental or personality disturbance not attributable to any known neurological or organic dysfunction.
Anxiety neurosis. Anxiety neurosis.
Characterized by diffuse anxiety and often somatic manifestations of fear.
Hysteria. Hysteria.
Neurotic disorder characterized by violent emotional outbreaks and disturbances of sensory and motor functions.
Anxiety hysteria. Anxiety hysteria.
A form of hysteria having features of both conversion disorder and anxiety neurosis.
Hysterocatalepsy. Hysterocatalepsy.
Hysteria with cataleptic symptoms.
Personality disorder. Personality disorder.
Inflexible and maladaptive patterns of behavior.
Antisocial personality disorder. Antisocial personality disorder.
A personality disorder characterized by amorality and lack of affect capable of violent acts without guilt feelings. Psychopathic personality was once widely used, but was superseded by sociopathic personality to indicate the social aspects of the disorder, but now antisocial personality disorder is the preferred term.
Maladjustment. Maladjustment.
The condition of being unable to adapt properly to your environment with resulting emotional instability.
Schizotypal personality. Schizotypal personality.
Characterized by symptoms similar to but less severe than schizophrenia.
Psychosomatic disorder. Psychosomatic disorder.
A mental disorder that causes somatic symptoms.
Schizothymia. Schizothymia.
Resembling schizophrenia, but remaining within the bounds of normality.
Section 2. In this section, we will explore affective disorder.
Affective disorder. Affective disorder.
Any mental disorder not caused by detectable organic abnormalities of the brain, and in which a major disturbance of emotions is predominant.
Bipolar disorder. Bipolar disorder.
A mental disorder characterized by episodes of mania and depression.
Cyclothymia. Cyclothymia.
A mild bipolar disorder that persists over a long time.
Depressive disorder. Depressive disorder.
A state of depression and anhedonia so severe as to require clinical intervention.
Agitated depression. Agitated depression.
A state of clinical depression in which the person exhibits irritability and restlessness.
Anaclitic depression. Anaclitic depression.
Severe and progressive depression in infants who lose their mother and do not get a suitable substitute.
Dysthymia. Dysthymia.
Mild chronic depression.
I thought she had just been in a bad mood for 30 years, but the doctor called it dysthymia.
Endogenous depression. Endogenous depression.
A state of depression for which there is no apparent precipitating cause.
Exogenous depression. Exogenous depression.
An inappropriate state of depression that is precipitated by events in the person's life to be distinguished from normal grief.
Major depressive episode. Major depressive episode.
Psychiatry, a state of depression with all the classic symptoms. Anhedonia and lethargy and sleep disturbance and despondency and morbid thoughts and feelings of worthlessness and sometimes attempted suicide, but with no known organic dysfunction.
Involutional depression. Involutional depression.
A major depressive episode associated with the climacteric.
Unipolar depression. Unipolar depression.
A major depressive episode that occurs without the manic phase that occurs in the classic form of bipolar disorder.
Neurotic depression. Neurotic depression.
A term used for any state of depression that is not psychotic.
Psychotic depression. Psychotic depression.
A state of depression so severe that the person loses contact with reality and suffers a variety of functional impairments.
Retarded depression. Retarded depression.
A state of clinical depression in which the individual is lethargic and slow to initiate action.
Mania. Mania.
A mood disorder, an affective disorder in which the victim tends to respond excessively and sometimes violently.
Craze. Craze.
State of violent mental agitation.
Mass hysteria. Mass hysteria.
A condition in which a large group of people exhibit the same state of violent mental agitation.
Nympholepsy. Nympholepsy.
A frenzy of emotion, as for something unattainable.
Section 3. In this section, we will explore anxiety disorder.
Anxiety disorder. Anxiety disorder.
A cover term for a variety of mental disorders in which severe anxiety is a salient symptom.
Generalized anxiety disorder. Generalized anxiety disorder.
An anxiety disorder characterized by chronic free-floating anxiety and such symptoms as tension or sweating or trembling or lightheadedness or irritability, etc., that has lasted for more than 6 months.
Obsessive-compulsive disorder. Obsessive-compulsive disorder.
An anxiety disorder characterized by recurrent and persistent thoughts and feelings and repetitive, ritualized behaviors.
Panic disorder. Panic disorder.
An anxiety disorder characterized by unpredictable panic attacks. The attacks are usually severe but brief.
Phobia. Phobia.
An anxiety disorder characterized by extreme and irrational fear of simple things or social situations.
Phobic disorder is a general term for all phobias.
Agoraphobia. Agoraphobia.
A morbid fear of open spaces, as fear of being caught alone in some public place.
Social phobia. Social phobia.
Any phobia, other than agoraphobia, associated with situations in which you are subject to criticism by others, as fear of eating in public or public speaking, etc.
Androphobia. Androphobia.
A morbid fear of men.
Gynophobia. Gynophobia.
A morbid fear of women.
Satanophobia. Satanophobia.
An abnormal fear of Satan.
School phobia. School phobia.
A child's sudden fear of attending school.
Traumatophobia. Traumatophobia.
A morbid fear of battle or physical injury.
Xenophobia. Xenophobia.
A fear of foreigners or strangers.
Post-traumatic stress disorder. Post-traumatic stress disorder.
An anxiety disorder associated with serious traumatic events, and characterized by such symptoms as survivor guilt, reliving the trauma in dreams, numbness and lack of involvement with reality, or recurrent thoughts and images.
Battle fatigue. Battle fatigue.
A mental disorder caused by stress of active warfare.
Section 4. In this section, we will explore phobia.
Simple phobia. Simple phobia.
Any phobia, other than agoraphobia, associated with relatively simple, well-defined stimuli.
Acrophobia. Acrophobia.
A morbid fear of great heights.
Algophobia. Algophobia.
A morbid fear of pain.
Aquaphobia. Aquaphobia.
A morbid fear of drowning.
Astrophobia. Astrophobia.
A morbid fear of thunder and lightning.
Automisophobia. Automisophobia.
A morbid fear of being dirty.
Claustrophobia. Claustrophobia.
A morbid fear of being closed in a confined space.
Cryophobia. Cryophobia.
A morbid fear of freezing.
Cyberphobia. Cyberphobia.
Irrational fear of computers or technology.
Hydrophobia. Hydrophobia.
A morbid fear of water.
Hypnophobia. Hypnophobia.
A morbid fear of falling asleep.
Mysophobia. Mysophobia.
A morbid fear of dirt or contamination.
Neophobia. Neophobia.
A morbid fear of novelty.
Nyctophobia. Nyctophobia.
A morbid fear of night or darkness.
Phobophobia. Phobophobia.
A morbid fear of developing a phobia.
Phonophobia. Phonophobia.
A morbid fear of sounds including your own voice.
Photophobia. Photophobia.
A morbid fear of light.
Pyrophobia. Pyrophobia.
A morbid fear of fire.
Taphephobia. Taphephobia.
A morbid fear of being buried alive.
Thanatophobia. Thanatophobia.
A morbid fear of death.
Triskaidekaphobia. Triskaidekaphobia.
A morbid fear of the number 13.
Zoophobia. Zoophobia.
A morbid fear of animals.
Acrophobia. Acrophobia.
A morbid fear of small insects and mites and worms.
Ailurophobia. Ailurophobia.
A morbid fear of cats.
Arachnophobia. Arachnophobia.
A morbid fear of spiders.
Cynophobia. Cynophobia.
A morbid fear of dogs.
Entomophobia. Entomophobia.
A morbid fear of insects.
Lepidophobia. Lepidophobia.
A morbid fear of snakes.
Musophobia. Musophobia.
A morbid fear of mice.
Section 5. In this section, we will explore nervous disorder.
Nervous disorder. Nervous disorder.
A disorder of the nervous system.
Amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis.
Thickening of tissue in the motor tracts of the lateral columns and anterior horns of the spinal cord results in progressive muscle atrophy that starts in the limbs.
Ataxia. Ataxia.
Inability to coordinate voluntary muscle movements, unsteady movements and staggering gait.
Friedreich's ataxia. Friedreich's ataxia.
Sclerosis of the posterior and lateral columns of the spinal cord, characterized by muscular weakness and abnormal gait, occurs in children.
Hereditary cerebellar ataxia. Hereditary cerebellar ataxia.
Nervous disorder of late childhood and early adulthood characterized by ataxic gait and hesitating or explosive speech and nystagmus.
Athetosis. Athetosis.
A continuous succession of slow, writhing, involuntary movements of the hands and feet and other body parts.
Adipognosia. Adipognosia.
Absence or loss of topognosia, inability to locate correctly a point of touch.
Brain damage. Brain damage.
Injury to the brain that impairs its functions, especially permanently, can be caused by trauma to the head, infection, hemorrhage, inadequate oxygen, genetic abnormality, etc.
Chorea. Chorea.
Any of several degenerative nervous disorders characterized by spasmodic movements of the body and limbs.
Huntington's chorea. Huntington's chorea.
Hereditary disease develops in adulthood and ends in dementia.
Orthochorea. Orthochorea.
A form of chorea in which spasms occur mainly when the patient is erect.
Sydenham's chorea. Sydenham's chorea.
Chorea occurring chiefly in children and associated with rheumatic fever.
Tarantism. Tarantism.
A nervous disorder characterized by an uncontrollable impulse to dance, popularly attributed to bite of the southern European tarantula or wolf spider.
Dyskinesia. Dyskinesia.
Abnormality in performing voluntary muscle movements.
Tardive dyskinesia. Tardive dyskinesia.
Involuntary rolling of the tongue and twitching of the face or trunk or limbs, often occurs in patients with Parkinsonism who are treated with phenothiazine.
Flaccid paralysis. Flaccid paralysis.
Weakness or loss of muscle tone resulting from injury or disease of the nerves innervating the muscles.
Kuru. Kuru.
A progressive disease of the central nervous system, marked by increasing lack of coordination, and advancing to paralysis and death within a year of the appearance of symptoms, thought to have been transmitted by cannibalistic consumption of diseased brain tissue, since the disease virtually disappeared when cannibalism was abandoned.
Nerve compression. Nerve compression.
Harmful pressure on a nerve, especially in nerves that pass over rigid prominences, causes nerve damage and muscle weakness.
Nerve entrapment. Nerve entrapment.
Repeated and long-term nerve compression, usually in nerves near joints that are subject to inflammation or swelling.
Carpal tunnel syndrome. Carpal tunnel syndrome.
A painful disorder caused by compression of a nerve in the carpal tunnel, characterized by discomfort and weakness in the hands and fingers, and by sensations of tingling, burning or numbness.
Section 6. In this section, we will explore brain disorder part 1.
Brain disorder. Brain disorder.
Any disorder or disease of the brain.
Acataphasia. Acataphasia.
A disorder in which a lesion to the central nervous system leaves you unable to formulate a statement or to express yourself in an organized manner.
Agnosia. Agnosia.
Inability to recognize objects by use of the senses.
Asteriognosis. Asteriognosis.
A loss of the ability to recognize objects by handling them.
Auditory agnosia. Auditory agnosia.
Inability to recognize or understand the meaning of spoken words.
Visual agnosia. Visual agnosia.
Inability to recognize or interpret objects in the visual field.
Agraphia. Agraphia.
A loss of the ability to write or to express thoughts in writing because of a brain lesion.
Aphasia. Aphasia.
Inability to use or understand language, spoken or written, because of a brain lesion.
Auditory aphasia. Auditory aphasia.
An impairment in understanding spoken language that is not attributable to hearing loss.
Conduction aphasia. Conduction aphasia.
Aphasia in which the lesion is assumed to be in the association tracts connecting the various language centers in the brain. Patients have difficulty repeating a sentence just heard.
Global aphasia. Global aphasia.
Loss of all ability to communicate.
Motor aphasia. Motor aphasia.
Aphasia in which expression by speech or writing is severely impaired.
Nominal aphasia. Nominal aphasia.
Inability to name objects or to recognize written or spoken names of objects.
Transcortical aphasia. Transcortical aphasia.
A general term for aphasia that results from lesions outside of Broca's area or Wernicke's area of the cerebral cortex.
Visual aphasia. Visual aphasia.
Inability to perceive written words.
Wernicke's aphasia. Wernicke's aphasia.
Aphasia characterized by fluent but meaningless speech and severe impairment of the ability to understand spoken or written words.
Apraxia. Apraxia.
Inability to make purposeful movements.
Cerebral palsy. Cerebral palsy.
A loss or deficiency of motor control with involuntary spasms caused by permanent brain damage present at birth.
Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease.
Rare, usually fatal, brain disease usually in middle age, caused by an unidentified slow virus, characterized by progressive dementia and gradual loss of muscle control.
Section 7. In this section, we will explore brain disorder part 2.
Epilepsy. Epilepsy.
A disorder of the central nervous system characterized by loss of consciousness and convulsions.
Akinetic epilepsy. Akinetic epilepsy.
Epilepsy characterized by akinesia.
Cortical epilepsy. Cortical epilepsy.
Epilepsy in which the attacks begins with an isolated disturbance of cerebral function, as a twitching of a limb or an illusory sensation or a mental disturbance.
Jacksonian epilepsy. Jacksonian epilepsy.
Focal epilepsy in which the attack usually moves from distal to proximal limb muscles on the same side of the body.
Sensory epilepsy. Sensory epilepsy.
Focal epilepsy initiated by somatosensory phenomena.
Grand mal epilepsy. Grand mal epilepsy.
Epilepsy in which the attacks involve loss of consciousness and tonic spasms of the musculature, followed by generalized jerking.
Myoclonus epilepsy. Myoclonus epilepsy.
Epilepsy characterized by clonus of muscle groups and progressive mental deterioration and genetic origin.
Petit mal epilepsy. Petit mal epilepsy.
Epilepsy characterized by paroxysmal attacks of brief clouding of consciousness, and possibly other abnormalities.
She has been suffering from petit mal since childhood.
Post-traumatic epilepsy. Post-traumatic epilepsy.
A convulsive epileptic state caused by a head injury.
Procursive epilepsy. Procursive epilepsy.
Epilepsy in which a seizure is induced by whirling or running.
Psychomotor epilepsy. Psychomotor epilepsy.
Epilepsy characterized clinically by impairment of consciousness and amnesia for the episode, often involves purposeful movements of the arms and legs, and sometimes hallucinations.
Reflex epilepsy. Reflex epilepsy.
A form of epilepsy in which attacks are induced by peripheral stimulation.
Musicogenic epilepsy. Musicogenic epilepsy.
Reflex epilepsy induced by music.
Photogenic epilepsy. Photogenic epilepsy.
Reflex epilepsy induced by a flickering light.
Status epilepticus. Status epilepticus.
A condition in which there are continuing attacks of epilepsy without intervals of consciousness, can lead to brain damage and death.
Tonic epilepsy. Tonic epilepsy.
Epilepsy in which the body is rigid during the seizure.
Paralysis agitans. Paralysis agitans.
A degenerative disorder of the central nervous system characterized by tremor and impaired muscular coordination.
Rise syndrome. Rise syndrome.
Acquired encephalopathy following acute viral infections, especially influenza or chickenpox, in young children, characterized by fever, vomiting, disorientation, coma, and fatty infiltration of the liver.
Wernicke's encephalopathy. Wernicke's encephalopathy.
Inflammatory degenerative disease of the brain caused by thiamine deficiency that is usually associated with alcoholism.
End of episode. Thank you for watching. If you enjoyed this video, don't forget to like, comment, share, and subscribe to our channel for more engaging content. In the next episode, we will present attribution.